Hello guys, once again welcome back to Medicos Lover YouTube channel. In this series we will be discussing about the menstrual cycle. This is the lecture number 2. If you have not watched the lecture number 1, it is compulsory to watch the lecture number 1 before proceeding this lecture for the more clarification and understanding. What is menstrual cycle? Menstrual cycle is the changes in the female reproductive cycle. It is mainly occurs in the endometrium of the uterus. Let's discuss it further. Menstrual cycle. Menstrual cycle is mainly a red fluid released through vagina. It mainly occurs in the primates, humans, monkeys, and apes. Not apes, it's apes. Now we discuss about the estrous cycle and the differences between the menstrual cycle and the estrous cycle. Menstrual cycle is mainly occurs in the primates, humans, monkeys and apes, but the estrous cycle is mainly occurs in the remaining mammals. Except this, but the remaining mammals, okay, and non-primates. In the estrous cycle, no fluid is released through vagina. Example आप देख सकते हैं. Before proceeding the menstrual cycle and be learning about it, we have to know about the key concept of the menstrual cycle. First, menstruation, that is called menarche. It is mainly occur at puberty stage. Stoppage and cessation, that is called menopause. It occurs at the 48 to 50 years of age in women. Duration of menstrual cycle is 28 days. It can even be evaluates. Menses, menstruation and bleeding phase. This is called the first phase of the menstrual cycle. In this phase, the duration of this phase is 3 to 5 days. It is mainly occurs due to the lack of progesterone. Progesterone and estrogen decreases. It mainly occurs due to the decreases of the progesterone and estrogen. Menstrual fluid released through vagina. It contains mucus, fluid, blood, and degenerative endometrium. Menstruation can occur if ovum is not fertilized. It is mainly occurs when the sperm is not reached to the fallopian tube and the fertilization not take place. In the last video, we have discussed about how a sperm and the ovum to form the zygote and attach with the endometrium. Lack of menstruation may be indicative of pregnancy. Okay guys, but it is not only the compulsion, it may be due to a poor health, stress. Okay, menstrual fluid can't be clot as other fluids clot. Now we move to further, that is called the second phase of menstrual cycle. It is called the proliferative phase and another name is follicular phase. It is mainly occurs from 6th to 13th date or days of menstrual cycle. Duration of this phase is 7 to 8 days. In this, FSH, LH and estrogen increases. It is mainly due to the FSH and LH and estrogen increases. Progesterone absent in follicular phase. In this phase, progesterone is not occur. Due to the lack of progesterone and the increases of the FSH and the LH, proliferative phase occurs. In this phase, two events eventually occurs. First one is follicular development and the formation of definite follicles in ovary due to the LH and FSH. B part is regeneration and repairing of endometrium of uterus through proliferation due to estrogen hormone. Estrogen secretion gradually increases. High level of estrogen induces anterior pituitary to release more FSH, LH, such that it can maintain endometrium and the further thickening of the endometrium such so that the zygote and the blastocyst attach to the endometrium and provide the nutrients for the developing embryo. This is the positive feedback of estrogen. More secretion of LH is called the LH surge, which induces release of egg from ovary, that is called ovulation. In the middle of cycle, at the 14th day, ovulation occurs. Release of secondary oocyte from ovary, as we have discussed in the process of oogenesis in the last lecture. In the middle of cycle, FSH and LH attain peak level. We have a graph in this which will be discussed further. Now come to the next phase, that is called luteal phase or the secretory phase. It is the last phase of the menstrual cycle and the duration of this phase is 14 days. After ovulation, graphene follicle changes into corpus luteum, as we have discussed in the last lecture. Please go through it once. It is due to the LH. Corpus luteum releases large amount of progesterone and estrogen for the thickening of the endometrium. Progesterone attain peak level in this secretory phase. Progesterone maintains endometrium for pregnancy. In secretory phase, progesterone and estrogen high, but FSH and LH low. It is like the opposite phase of proliferative phase. The most important concept is that the estrogen present throughout the menstrual cycle. Now let's discuss this graph. In the y-axis we have shown the hormones and in the x-axis we have shown the days. Blue color shows estrogen, red LH, yellow progesterone and green FSH. As we have discussed that the estrogen present throughout the menstrual cycle. So estrogen is high and is present throughout the menstrual cycle. With the help of the red color we have shown the LH. As we have known about that at the 14th day LH surge occurs, and we can see by this graph. It's the more clear by using this graph and get the more marks if you had made this graph in your exams. And the yellow color shows the progesterone, and progesterone is not present in the proliferative phase, but in the secretory phase it is present. And FSH is eventually present only in the LH phase and decreases in the secretory phase, as we have discussed in the phases. So it is now more clear. All the very best for your exam. Thanks for watching.